called attention deficit hyperactivity disorder. That means ADHD. When we say ADHD, it is quite common for us. This condition is also considered as a type of learning disabilities. Okay, because this disorder is also caused by lagging behind of our development of nervous system, and other causes are just same with the causes of other types of learning disabilities. A child with ADHD shows some such kinds of symptoms, like they find it very difficult to play quietly. If I ask him or her that play quietly, please don't make noise, be busy with your playthings. Okay, it is difficult for him to play quietly. Okay, another point, they are very inattentive, they don't pay attention to you at all, and if you tell him or her something also, he will not be able to pay attention, or he will not be able to listen to it carefully and follow this instruction. If they are there to play some turn taking game, like I have to wait for my turn to play it, okay, then I have difficulty because I am ADHD. Okay, so I have difficulty waiting for my turn. Rather, I will prefer that let them come behind me, let me go first, after playing I am free, all my friends will play after me. Okay, this will be my thinking because I am a child with ADHD. A child with ADHD talks excessively. Again, he or she is prone to leaving the seat every now and then. For example, in order to complete this class, we have to sit at our own place for 30 minutes or 25 minutes, for example. But this is not possible for a child having ADHD. He or she will tend to leave the seat every now and then. Okay, or if we ask him, don't leave your seat, sit down, like that, then also they will just fidget like this, like they will show you that they are not at all interested in sitting at one place. Okay, you will come to know from their body language that they often lose things. Okay, things means, for example, you ask him to write something, then most of the time he or she will be with no pen. Okay, no, I lost my pen, I lost my pencil, means they will not be able to pay attention to what you are saying and what they should do according to your instruction. That is impossible for them. So when will these characteristics be exhibited in a child with ADHD? Obviously, these characteristics will be shown by the child before his or her age of 7 years. And it's not that one day the child showed hyperactivity, so he is hyperactive or she is hyperactive, she is having ADHD. Not like that. Okay, these symptoms should be shown by the child constantly, continuously. Then only we will think that the child has ADHD. Other than that, if such behavioral conditions, if this inattention, if this impatience, all these type of things, if this hyperactivity, if this lack of attention or concentration, if these things are shown in at least 2 situations or more than 2 situations, then we can think that that child is having ADHD. What are those situations now? Home situation. Okay, like in your home, one environment, home environment is there, so that is your home situation. In school the situation is little bit different. If you visit some of your relatives' place, then also it will be, the situation is, the environment is little bit different. In some get together, the environment will be little bit different. In this way, if the child shows this type of behaviors in at least 2 situations, then we think that he or she may have a condition of ADHD. One more thing is there, like this hyperactivity condition is also encouraged by some food items. It is found in research that some food or food products may also encourage the cause of hyperactivity. Like if the family is used to taking more of processed food or colored food, then obviously the child will also eat those food. Okay, so in that case, such type of processed food or colored food may cause hyperactivity in children if those are taken since a very early age. Okay, so in case of food also we need to pay some attention. Okay.